Okay, so it is 3 after the hour. We will go ahead and get started. For those that have just joined, my name is Ashley Pappas, and I am a field representative with Gainwell Technologies, which is the fiscal agent for Nevada Medicaid. I am going to be facilitating today's prior authorization overview training. Also with me is Susan Harrison. So our objectives today, we are going to outline the prior authorization basics. I do just want to have a disclaimer that we're not going to be getting into provider-specific issues or denials, or if you're noticing certain trends, we aren't going to be addressing those types of issues today. That would be more so of maybe a one-on-one with your field representative, which we'll go through how to contact at the end as well. We're going to locate the required general forms for prior authorization, as well as navigate the prior authorization submission process, and then discuss instances that might arise after submitting your prior authorization request. And then, of course, at the end, locate additional resources for you guys. So just starting out, what is a prior authorization? So a prior authorization is an approval from Nevada Medicaid for a service that may require authorization. It is to be submitted, of course, before the service is rendered, unless, of course, in specific emergency situations outlined in your billing guidelines or the Medicaid Services Manual.
We can start you out though with
So this is used to determine the medical necessity of a service. It is not necessarily a guarantee of payment because other factors do apply when it comes to submitting the bill. A prior authorization is necessary, of course, when your billing guidelines or policy dictates that it is. So for these submission deadlines, and I will show you where you can access this information on our Medicaid site, so do not feel like you have to write all of this down or remember this right now. But for the submission deadlines, unless otherwise noted, the timeframes are in business days prior to the service. So depending on the type of service, just to show some examples here, for maybe an inpatient med surg, say, or so that planned admission, you want to get it in at least 2 business days prior to admit. And then we do have some other examples here, just depending on your provider type. So if you're home health, you have 15 days from the start of care to be considered within timely for the authorization request. I'm going to jump to the next site and go to the Medicaid site. So the first, okay, so starting out, I am on the main Medicaid website here. I'm going to post it in the chat just in case you want to follow along. Otherwise, you can just save it. You'll go to this website quite a bit during your time with Nevada Medicaid. I do want to start out on the billing information page. So I'm going to go to providers and billing information. And the first thing I want to pull up is that manual. So that slide that I had just displayed earlier with the time frames, we do have that same information located in this billing manual. Forgive my scrolling. I'm going to go up to the table of contents. There we go. Okay. And so in the billing manual for prior authorizations, we're going to utilize chapter 4. It is hyperlinked, so we can click on it and it'll take us down to that chapter rather than, of course, scrolling through the entire manual. But the timeframes are also going to be listed as in here, as well as information on how to, after an authorization is submitted, appeal a denial or request a peer-to-peer, but I will also get into that when we jump back to the slide deck. But just a resource that you're going to want to be able to know how to access. The next thing on this billing information page that I want to direct you to is the billing guidelines by provider type. So this is going to be specific to your provider type and the requirements, and that will include prior authorization as well. So I am just really quick to demonstrate. I'm going to pull up hospital inpatient. And whichever servicing provider type you are, if you're a durable medical equipment provider, if you're a home health provider, if you're a dental provider, whatever the case may be, when it comes to your billing guidelines, you will have prior authorization instructions. So you can see here on this, for example, we do have authorization information, the forms that you're required to utilize when requesting the authorization as well. So again, depending on your provider type, it may differ, but you can access that in the billing guidelines by provider type. So I am next going to just move to the forms page. and still under the provider's main tab, but this is where you can locate all of our prior authorization forms, and they are in numerical order. So of course, depending on what your provider guideline depicts, or even your Medicaid service manual policy chapter, that would be the applicable form. So the example I like to throw out for inpatient would be the FA8 form. It is your responsibility to make sure that this form is completed, and there are certain situations where maybe additional documents are going to be required as well with the form, of course, depending on the service type. But this is where you can access all of your forms. I do want to scroll down, and I will touch on it more a little later, because for those adverse determinations, so after you submit your prior authorization, if you ever do need to maybe submit, we call it a reconsideration or an appeal for a prior authorization that maybe was denied or cut back, you didn't get the full amount that you requested, the reconsideration request form or appeal form is located on this page as well, and it's the FA29B. But while I'm here, I did just want to call that out. So the next thing I want to jump into, I'm going to scroll back up. It's under our featured links. Of course, how do you know if a service requires authorization? We do have ways that you can search, of course, in your billing guidelines or the Medicaid Services Manual chapter, but you can also utilize our authorization criteria feature. So under featured links on the website, I'm going to click this link. It will take you to the login to the web portal, but you do not have to be logged in. We're just going to scroll down a little bit further under these featured links and click the link again. Now for the authorization criteria, you can search a few different ways, and you can search by your provider type, so your 2-digit provider type. So depending on the type of service, if it's room and board, it could be a revenue code, medical would be your CPT code, and dental, of course, for your dental service providers. I am going to start with a medical code. And then you can type in, if you actually know the CPT code or maybe the description, you can search that way. I do have an example here, so I am going to use this code 876, and it will also auto-populate a description for you. And then the provider type. So that, again, it's that 2-digit. So this is a behavioral health code. So I'm going to search with PT14. And we do recommend to actually leave the specialty blank. You'll get a wider variety of results. They'll display them all. So we'll hit search and scroll down, and we can see here if it is always required or if it's required after exceeding service limitations. It'll give you a good indication of what the service limitation is. I do want to add as a disclaimer here that if an authorization is not required, you'll get something like, I'm going to actually display the code now, just so you can see. Oh, actually, let me try this one. Oh, it's cutting me out. Awesome. Oh, hold on. Let me try this again. 876. There we go. So if an authorization is not required, you will receive this message below. There are no records found based on the search criteria entered. But as a disclaimer, I just want to let you know, if, for example, it's a service code that's not payable to your provider type, you'll also get that same message. So you can see here, I put outpatient hospital. They're not able to bill 90876. So it's going to populate that error. So a good indication to just make sure, extra verify if an authorization is required for the service that you're providing, is to first make sure that it's payable to you. And that is done couple of different ways as well. On the main page, you can search fee schedule, where you can search by provider type and code, or under quick links and rates unit, you can make sure it's separated also by provider type. Accept the terms and conditions really quick, and your fee for service fee schedules. But we have a list of all payable codes depending on your provider type. So if the code is listed here as payable and you do receive the no results found, that's an indication that a prior authorization is not required. Okay, I am going to close some of these tabs and get back to the main site. There we go. So the next thing I did want to touch on before we hop into the training environment and I go over some more finer details with prior authorization, I want to go to our training page. And so I did just want to call out here specifically on this page, if for any reason you do want to discuss those more in-depth authorization adverse determinations, or maybe if you are having issues with prior authorization, since today's training is more of just a basic overview, you can reach out to your field representative. If you're not sure who that is, we do have a list that is separated by provider type. We do ask that you do initiate the process with Nevada Provider Training at Gainwell Technologies, and you just include your NPI. The next thing I did just want to demonstrate on this page is we do have some helpful reference guides and tip sheets, especially when it comes to prior authorization. So I'm going to scroll down here. Get to our tip sheets and quick reference guides. So we do have a prior authorization reference guide. Oh, and thank you, Susan, for posting that email in the chat. We do have a prior authorization quick reference guide, and this, I'm going to open it up here. This is going to be a great resource if maybe you're noticing when you're completing the authorization, you're receiving some errors on the screen or having trouble entering information. This is kind of a resource of common errors, common issues, and how to correct those while you're completing the request. And then I'm going to scroll down a little bit further, because we do have workshop materials. So of course, depending on if you are a pharmacy provider, if maybe you are a hospital and you utilize a PASSAR system, we do have tip sheets for that as well under the workshop materials. And I do just want to call out one more resource that is really helpful. It's under prior authorization training materials. We do have a tip sheet for how to initiate an authorization request. So if you do need to refer back, you're not sure how to start the process at all, I will kind of walk through it a little bit today just to show you, but this is a great resource that will provide pictures and step-by-step of how you would at least initiate the process in the portal. Okay, so I am going to hop in to get logged in. So this is the training environment we are going to utilize. And just as a disclaimer here as well, there is no live patient data in here. So we're going to be seeing some fictional data just to stay in line with compliance. I normally would submit this through a hospital portal, but that is okay. We can use this hospice one for today. I am going to start at the care management tab. So when we initiate a prior authorization, we do, of course, after eligibility has been verified, want to make sure that we have the patient information, the applicable form that we need for a prior authorization request, and of course, any medical documentation that is also indicated as required, depending on the service. So we'll start with create authorization. And I always keep an eye on it here. I can see that it's loading. There we go. So on the main page, you will auto-populate to medical. Of course, that will be what will stay unless you are a dental provider. So we're going to do a medical example this time. So depending on the process type, it is also, of course, depending on the service that you're requesting. So if you are a DME provider and you're requesting equipment, if you're an inpatient hospital and you're requesting either inpatient med surge or behavioral health inpatient, just depending on the service type is going to have a dictation on the process type as well. In this example, since I am in a home health, not home health, excuse me, a hospice provider, I'm going to keep it kind of in order just to not cause any confusion. So I'll make sure I'm requesting hospice as the process type here. Under the requesting provider information, this is you. So this auto populates the information for the portal account that you are under. So I am under Honeycomb Hospice right now. If you were under, obviously, your provider, that is what would populate for you. I am going to grab a Medicaid ID here for the example. And hopefully at this point, you have that information since they should have Medicaid eligibility. I do like to, after I enter the information, click out of the field, it will populate the recipient's information for you. That's just a good way to make sure that you are requesting for the appropriate recipient. I'm going to go down here. Now, for referring provider information, you'll see there's no red asterisks in these fields. That's because it may not always be required, depending again on the service that will be dictated in your billing guidelines as well as your policy chapter as well. So it may not always be required. If it is, you do want to make sure that the referring information you're listing here is for an enrolled provider as well. So I am going to utilize an NPI that I have. And then you do want to make sure you are indicating the ID type. So NPI, we don't use APIs anymore. And I want to get to the service provider information. So unless you are, and this is pretty common for maybe surgeries or inpatient hospital transfers, or even if it's a physician making the request, the service provider information, if you select this box here, it will auto-populate your provider's information, which again is tied to the account you're under. So if you are completing this on behalf of another provider, you want to make sure you actually type into the fields their NPI, then their service location information will populate. In this example, it's going to be the same because I'm an agency requesting hospice services at my agency. So I'm going to scroll down here, and under diagnosis information, you do want to start out at least with the primary diagnosis, and then you can enter additional and any other applicable diagnosis. For the sake of time today, I'm just going to enter 1, of course, not with that decimal point. There we go. And then I'm going to move down to the actual service detail information. So here is where, of course, if you are requesting a prior authorization for a service that is maybe a planned surgery or a planned, in this case, hospice admission, the date should always be a future date unless there are certain scenarios dictating otherwise, of course, in your billing guidelines. In this case, I am going to put a future date here. Let me retype that because that did not like it. There we go. And then depending, of course, I am under hospice agency, so I'm working with revenue codes, but again, you may work with CPT codes. It will also populate a description for you, and then the number of days. So we're going to put 60 here. And then for your medical justification, something does have to be indicated in this field. Typically, what I advise is that if there's anything specific in regards to the recipient that you want the nurse to know, that is what you would want to indicate here. So it can be in regards to their diagnosis. It can be in regards to why an authorization is being requested and why it's needed. But just make sure if you want a nurse to see a specific note that you do indicate that here. So I'm just going to put be advised of diagnosis just so we can move it along. And you do want to make sure you add the service. It will populate for you, and that's a good indication it did get saved. So we can see here we have the option to remove. And then I am going to go down to the attachment section. So the transmission method, it does default to EL electronic only, so you'll never have to adjust that. I do just want to advise as a disclaimer here with the attachments, you are only able to upload 4 megabytes at a time. So that includes the total of all combined attachments, or if maybe you have one just large attachment that's exceeding that, you do want to make sure you're not going over 4 megabytes. We do have a workaround, so if for any reason you're not able to attach all of the files you wanted to on the first go around, you can just get it into appended status. I'll demonstrate that, and then immediately go back in, edit the authorization, and add the additional documents so that all of the required documents you need are successfully uploaded. But I'll demonstrate that after I get this pended. For the attachment type, there is no wrong answer either. The attachment type description actually doesn't even come over to our nurses, so they can't even see what you selected as the attachment type. So good rule of thumb is just the description that best fits the document you're uploading, but you won't get a denial for that. We'll add the attachment. And so if at this point, depending on how many documents you uploaded, or if you uploaded one large document, if it was too large, you would actually receive an error at this stage. So it wouldn't take the document at all. You could then just go through, hit submit, we'll get it into that pending status, and then I'll show you how you can add those additional documents if you need to exceed that 4 megabyte. Before I do that, before you hit confirm on this page, because this is the last chance you'll be able to go back and make any modifications to this information. So you won't be able to modify the provider information, you won't be able to modify the service information. So after you hit confirm, if you needed to make any modifications to that information, you'd actually have to submit a data correction form. So to avoid that, I just recommend going through the confirmation page, making sure everything you entered is correct before hitting confirm. And then we will immediately get our authorization tracking number and that it's in a pending and process status. And here it is. I'm going to copy it just to have it, but if for any reason you weren't able to upload all of your documentation, we can fix that right now. So we'll go into care management, view auth status, and then it will populate here under prospective authorizations if it's current and approved out through the future. Any past authorizations, you would have to utilize the search options tab. You can search with the PA number or you can search with the Medicaid ID and a day range. Since I'm here, I'll go ahead and do that. I'll scroll down and you do have to click into the prior authorization link. So we'll do that.
This is not a work-related accident.
Okay, and so here we can see the status. I am going to talk about the different status options you'll see under decision or date. But if for any reason you need to upload those documents, again, you just edit the PA. You can go all the way down to the bottom and just add the additional attachment and resubmit. And that is just the workaround for exceeding that 4 megabytes. If you have those additional attachments you weren't initially able to upload to get it to submitted. Your tracking number will remain the same. And that's just that workaround that we have in the meantime until we get a larger file size capability. All right, so I am going to jump to the actual status of your authorization. So I'm going to go back into care management, view auth status, and I have a few examples here. So of course, what we want to see when you're requesting an authorization is you want it approved, right? So for our approved authorizations, those are listed as certified in total. And I actually remembered that is for my, let me go back. These prior authorization examples are for my hospital, so they're not going to be in here. That is okay. I will use this one. Okay, so when you are checking status, and I do just want to advise that after you do submit the request, it is your responsibility to go in and check status. We will, of course, send an adverse determination letter, but once a decision has been made, you can also access it directly in the portal. I'll show you how to do that as well. But if for any reason you submit the request and a nurse comes back with maybe they need additional information or clarification on something, you will only have 5 business days to provide that. So that is why you want to come in here and at least check the status, make sure after you submit it, you're not just letting it go. For the status options, so of course, after you submit, you are going to see it's in a pending status. If a nurse kicks it back, maybe for additional information, the status will change to pending additional information, and there'll actually be a date listed here as well. So that's if it gets maybe kicked back to you for clarification. There will also be notes under the medical citation section here of what it is they're needing clarification wise. Another status that you will see is that certified in total. What that would mean is that what you asked for, you got. There were no modifications made to the authorization request. That's, of course, what you want to see. And then you may see a certified partial. That just means there was a modification made somewhere. So maybe you asked for 30 units and we're only given 20. There will also be a medical citation listed there with that as far as why it was partially approved. The next status you'll see a possibility of seeing is denied. Of course, we never want to see that. Or in here, it'll say not certified. With that, there will also be a medical citation telling you why. But when that happens, once there is that decision date listed, you can actually access the letter right away. You don't have to wait for it to be mailed. So under resources, I'm going to just click it here and report download. You just want to change the report category to prior authorization letters, and you can search either by the prior authorization number, the Medicaid ID, and your from and to date on the authorization. So that's just a way to pull the letter as opposed to waiting for it to be mailed out. Now I am going to hop back to the slide deck just to finish and go over a few additional things, but this is some more information on after your authorization is submitted, if it's an approved status or a certified in total status, you need to make any modifications. So for clinical modifications, that would be updating the level of care, right? So a good example I do like to use is for inpatient, for updating a revenue code for room and board. Maybe they came in under acute and got transferred to ICU, but essentially it's changing the level of care for the service that you were providing once approved. We call that an unscheduled revision. That is typically something that needs to be done prior if it's an increase, unless it's an emergency situation. That's what these bubbles indicate here. So an increase in level of care planned needs to be submitted prior to the change. If it's an emergent switch, then you have 5 business days to submit. Now, if it's for a decrease or a lateral change, so maybe you just need one acute code changed to another acute code, it's not necessarily a switch in level of care, or if maybe it was approved under ICU intensive care and you need to go down to acute, whatever the case may be, those just need to be submitted prior to the billing of the claim. So for any changes to non-clinical information, so like I had mentioned earlier, a data correction form. So if after you hit submit, you realize, oh, I requested the wrong date, or oh, this is for the wrong provider type, whatever that case may be, that would be considered non-clinical. Clinical is when you're getting into the level of care, and CPT code or revenue code. But if you need to maybe make a correction to a date or a recipient's name, sometimes that happens, which really the nurse reviewer should catch that, you can submit a data correction form for that. And these are also located on the forms page as well with the prior authorizations. Okay, so for your adverse determination, we're going to start with denied or reduced authorization requests. So there may be a scenario where you receive a denial not for medical necessity, but we call it a technical denial. An example of when you would receive a technical denial is maybe if you're requesting a service that's either not payable to your provider type, a service that doesn't require authorization at all, or maybe you're submitting. A big one that I see for technical denials is for hospitals submitting for room and board under outpatient services. So that would cause a technical denial as well. Those cannot be appealed. That is really you're needing to make the correction and remake the request. Unfortunately, with that though, you do lose the days. So you don't get to request a retro if there's an error made on the initial request causing a technical denial. Now, a denial, that is going to be not meeting medical necessity. Again, these will be indicated in the medical citations as far as why you received a denial and whether it was for technical or not meeting medical necessity. Now for a reduction, I did touch on that. That would be your certified partial status. So maybe you asked for 20 units and only got 15. You do have the right to submit a reconsideration for that. So the few options we have in addition, well, the other option we have in addition to a reconsideration request, we call it a peer-to-peer. So that is where your physician would sit down with our physician and discuss why the adverse determination was made. I do just want to call out a peer-to-peer does not overturn a decision. It's just to better understand why the decision was made. So you do have the option to request a peer-to-peer within 10 business days of the adverse determination. We do have a peer-to-peer email that's located in the billing guidelines, and that is how you would initiate that request. And then you can have the option to request a reconsideration after your peer-to-peer. You just want to make sure you don't request reconsideration and then go back and try to request a peer-to-peer. It would have to be in order. So peer-to-peer first and then reconsideration. The reconsideration requests, you have 30 days, and then it does also depend, I believe RTCs have, Susan, do you off chance know, I think they have 180 days for an appeal?
So most reconsiderations are 30 days. RTCs, PT63s, those are our residential treatment facilities, have 90 days. And then our
Thank you.
PT85 ABA providers have 180 days. So everybody else is subject to that 30 days.
Thank you so much, Susan. And it will be differentiated, of course, in your billing guidelines as well. So don't just assume, make sure you're checking. And then we do have that peer-to-peer email populated here. But again, it is located as well in the billing guidelines. Well, the billing manual, excuse me, the main billing manual. All right. So what is that reconsideration? Or I interchange it with, thank you so much, Susan. She also posted the billing manual in the chat. So what is a reconsideration? Or I usually interchange that word with appeal. That's a written request to re-review a denied or reduced prior authorization request. Just a reminder again, it's not available for technical denials. You'll know if you have a technical denial in the medical citation. And then this is just that reiteration of the timeline. So 30 calendar days, and then depending if you are an RTC or an ABA provider, you may have additional time, but again, never assume, check your guidelines. The form for the reconsideration request, I did call it out when we were on the forms page. It is that FA29B form. That is the reconsideration request form. Your data correction form is that FA29. Now, when you are submitting a reconsideration request, you do want to make sure just to better your chances. So if you do receive a denial for a reduction, let's just say, you want to add additional documentation to support why that reduction is causing issues. So why you in fact should receive the full amount that you requested. So it's just any additional documentation not already submitted, of course. You don't need to resubmit the same documentation. It's typically new documentation to support why you really need what you asked for, or the recipient needs, I should say. All right, so let's say you have an approved authorization for a set amount of days and you need more, you need additional time. So that would be a continued stay request. Also concurrent review for those inpatient stays. So again, this is used when a recipient requires service dates that were not requested or approved in the initial authorization. The inpatient hospital concurrent request services, the time frame for that is within 5 business days of your last authorized date. For those continued stay requests or additional days, you will be subject to your billing guideline and your policy on how many days you may have. So just keep that in mind as well. And this is just a note, all other continued must be received by Nevada Medicaid by the last authorized date. But of course, just that disclaimer, unless specific requirements contrary to these instructions are outlined in the billing guidelines for your provider type. Can't stress that enough on this PA overview. So before I jump into resources, I will go in just to reiterate for a technical denial, that is going to be something that maybe hits because you're requesting, like maybe you have an error when you're submitting the prior authorization request. Like an example would be maybe you didn't submit with the required prior authorization form. That's considered a technical denial versus maybe denial for medical necessity. So essentially the amount of documentation that you submitted didn't support medical necessity. So maybe you received a denial for that. That is different than a technical denial. Technical indicates error. So a technical denial, which you would know it's a technical denial in the medical citation, that cannot be appealed. You would have to resubmit. And you do lose the days that you initially requested on a technical denial when you do resubmit. Okay, so I am going to hop back over here to the resources. So I did mention that we do have a takeaway document for you guys. This is located in the LMS system that you use to register for this course, as well as maybe access it if you didn't add it to your calendar. But there is a tab under the PA overview training for resources. That's where you can pull our takeaway document, which will have links to the important resources that I did cover already today at the start. And I do want to get into the contacting Nevada Medicaid. So our prior authorization does have its own customer service. It is different than the main customer service line. That number is the 800-525-2395. That is if maybe you need a clinical question answered and you need to talk to a nurse, they can be reached there. You just may have to leave a message, but depending on the process type, there will be different options when you call this number to select. So if it's for inpatient, it may be option 2. Don't quote me, but you just want to make sure if you're a DME provider, you're indicating which process type you're requesting so you get to the right place. This is that email that Susan put in the chat for you. So if you would like to be put in touch with your field representative for your provider type, you can initiate the process there. Just include your NPI. And then we do have the main customer service line, so they can answer more mechanical questions versus those clinical questions in regards to prior authorization. So if you're like, where do I find the forms? They can provide navigation at the 877 number. So that does conclude everything I did want to go over today for prior authorization overview.